Good morning, good afternoon, good evening. This is a wonderful webinar, I hope, jointly with UNESCO and the Research Consortium for School Health and Nutrition. Last year, at the end of last year, I was invited by UNESCO to go to Fortaleza for their global education meeting, where for the first time they rolled out their new ideas on the importance of well-being for education outcomes, the link between health, well-being, and educational achievement. Before that, there'd been a discussion with the GEM UNESCO team, actually a discussion at COP28 in Dubai, about doing a joint paper, a paper which has become this Learn to Eat Well paper. This is the second in a three-part series developed by UNESCO GEM, which is looking very specifically at the relationship between education and the other SDGs. This is the one on nutrition, the SDG on nutrition. It was launched at the March meeting in Paris of the Nutrition for Growth meeting event hosted by the French government in Paris in March, and we're going to look at that paper. We're going to hear from some organizations outside of education who have endorsed the paper, endorsed its text and endorsed its recommendations. And we're going to look at those recommendations, the endorsing the importance of lifelong learning about how nutrition and understanding food, your relationship with food, can be transformed by the education system, and that the whole learning that we have from birth through the whole life course can change our relationship with food in very positive ways. So we're going to hear from those organizations about those recommendations, and then we're going to pivot to an interactive dialogue with the authors of this report. And if you've got any questions at any time during the session, put those in the Q&A, and we'll pick up on those at the end with the authors. So that's enough to get us started. Manos Antoninus and I will now go together through the paper. We produced some slides for that, and we'll look forward to reconnecting with you as we do that. So shall we start, Manos?
Yes, thank you. Thank you very much, Don, and thank you everyone for joining today for this webinar, which tries to link different worlds together. As Don rightly said, this is the second in a series. We have been trying to work on the mandate that the Global Education Monitoring Report has to monitor education, not just on its own, but within the Sustainable Development Goals. The first report in the series in 2016 did precisely that. But we carried on publishing results on the interrelationship between education and the other development goals in our global reports that are published every 18 months. But at some point we felt they were not getting sufficient attention, which is why we decided to extract this line of work and turn it into a series. The first one was on climate change last year, and the report that we are discussing today was launched at a side event as part of the Nutrition for Growth Summit in Paris in March. The third in the series is scheduled for early next year, and it will be focusing on justice. So you see there's quite a wide range of topics that we're trying to look at. All reports are having quite a similar structure, and you will see that throughout this presentation. We look at broadly the interrelationships, and these can be very broad in very many levels, layers, and dimensions. Then we look at particularly how education can help achieve the outcomes. First, thinking in terms of the different levels of education from early childhood to adulthood, but then also between the different types of learning, because it's not only about formal learning, but also non-formal and informal, and all these play a role. And then we also try to look at the impact of education on preparing professionals, those who are actually going to be delivering these outcomes, which is a very important aspect we tend to kind of neglect. And finally, we try to also have a few words about how the two outcomes can be monitored jointly. So let me go through this presentation. I will start, and then Don will talk more specifically to the issues related to school meals. So the report is, of course, learn to eat well, but it could have been also its reverse, because education is supporting healthy nutrition and food choices, but it's also nutrition, as we know, that enhances cognitive development and therefore maximizes the outcomes that we can get out of education. And that's not only in school, but also throughout life. And that's the type of approach we are taking on a life cycle perspective and a system-wide perspective. I will not tire you with this graph, but I invite you to check the report and see how we have conceived these multiple layers, the cyclical nature of the relationship between education and nutrition. Now, we know very well, and I think Don is the best place to say that the emphasis has generally been on early childhood, the link that nutrition has in the early years. And it's true, there are long-lasting benefits that start already before children are born, but breastfeeding is quite a strong example that highlights that relationship with more educated women having that advantage in ensuring that they stick to breastfeeding practices. And we know very well, and the graph reminds us from the wide range of demographic and health surveys around the world, that women who are more educated are more likely to have children that are not stunted, not underweight, and not wasted compared to children of less educated mothers. But enough with me for the time being. One of the main objectives of this report was to also highlight the importance of the education-nutrition relationships at the school level and in adolescence. Don, you can take over.
Thank you, Manos. And I really do love this title, Learn to Eat Well to Learn. And I think that's those two messages that are really important. And as you said, we all know how important the first years of life are, the first 1,000 days of life are, including that mother eats well during pregnancy. These are all vitally important parts. But what we're starting to get to grips with is that in order to seize on those early gains, you also need to eat well throughout your school age years, eat well, and learn good dietary habits that will then last you for the whole of your life. That's really the big message here. And what we're seeing is that that schools can provide a second window of nutrition opportunity, that children can catch up who've been stunted, who've missed out in those first 1,000 days. But they can catch up not just in physical growth, but also in mathematics, reading, and vocabulary. So stunting isn't for life. It doesn't need to be for life if we take that view. And what we're seeing is that relatively modest investments in children in low and middle income countries can add up to half a year of quality schooling and improve test scores. And so we see this when we look at studies across the world, and there are now a number of excellent studies that have been published, and they're referred to here in this book. I think the next slide is mine as well. Yeah, and school implementation, of course, varies greatly across countries, but it also varies depending on the level of education. So primary schools, much more popular than secondary schools. That's actually a problem even in rich countries. Children who go to secondary school, often it's an issue as to where they get their food from. And even when nutritious food is provided, they often prefer other more fashionable alternatives. What we are seeing then is that the levels of investment vary widely. doesn't say it here, but 98% of costs of school meals are actually covered by countries themselves, domestic funds. But there are still countries, low-income countries, countries with less fiscal space, who do need support from international sources, particularly at the primary level. I could have the next slide there. And what do we need to see? What do we see is necessary for holistic nutrition education? Is a curriculum that matches that. That it's one thing to feed children, but they also need to understand why they're choosing those foods in particular, and understand what nutrition means, why making particular choices, diverse choices of food is important, and also understand about planetary health and how choosing the right foods also say it may improve your health, but it also improves the health of the planet. And so this is linking education with school food is a really key part of the program going forward, and that's why it's so exciting that UNESCO is pushing this message out too. Next one. Is it me? Am I the next one, Manos?
Yes, a couple more. This one and the next one.
Okay. So that nutrition education should be experiential. In other words, that it should go beyond theory and be practical things. The children, we all know that. All of us who are interested in pedagogy know how important it is to actually do things as well as hear about things. So building practical food skills, including cooking and gardening. School gardens are a great way of engaging children in understanding food. Cultivating critical awareness of food systems and promoting sustainability in health. And this is the planetary health issue as well as our own human health issue. And let's not forget the role of universities as key mobilizers in this kind of experiential thinking. And then I think my last slide is the next one. So that those approaches actually do deliver results. This isn't theory. We've got countries all over the world. More than 420 million children are fed every day. 420 million every day, and they're fed by countries. The biggest program in the world is in India. Second biggest is in Brazil, where in both those countries the programs are near universal and linked to local agricultural production. But we have other examples, and I want to highlight France, part of a system-wide approach to address obesity. Japan, where the Shoko-iku approach is a pro-social approach. The idea that when children sit down for lunch, sit down with their teacher, they feed each other, they serve each other, they clear up after each other, they learn etiquette, they learn societal values. This has become a really important issue and a concept that Japan School Meals Program has effectively exported. And then finally, just to come back to Europe again, Slovenia is combining school feeding and physical education as a direct way of addressing childhood obesity and better lifelong health. Over to you, I think, Manos.
Yes, indeed. And thank you, Don. The link of school feeding policy with well-being is not limited to just the provision of a school meal. It is also very important that these meals are nutritious, they're of good quality. But then it is also important that they come in an appropriate environment. And unfortunately, young people, even when they are trying to eat in a more healthy way, they face an environment that is not very suitable. Often they're subject to aggressive marketing. You see on the right-hand side this graph that there are a lot of young people who try to make a special effort, for example, to eat less sugar or consume fewer sugary drinks. And yet, in countries like Mexico and Chile, almost all of them were exposed in the previous few days to that survey by advertisers of these particular products. Only 29% of countries had measures restricting food and beverage marketing in schools. In recent months, since the publication of the report, we have seen new policies in Jamaica and Spain that try to take measures in that direction. But sometimes the odds are stacked against the more disadvantaged populations. In Santiago, in Chile, poor children had 3 times as high a probability of having an unhealthy food outlet in the vicinity of their school compared to rich children. Now, healthy eating requires awareness, and yet we often find out that nutrition knowledge is poor because it's not enough to have a school meal. School meal is a social service. It can be delivered at the school, which is extremely important and a huge advantage. But it needs to be also combined, as we heard in the earlier, by curricula and practices that deliver good quality nutrition education. A survey in 4 Arab countries found that the majority of young people under 25 got information on nutrition from social media. And perhaps as a result, the majority of them lacked adequate nutrition knowledge. Sometimes it is also a matter of not just the consumers being aware, as they are in Vietnam, of the safety practices, but the providers of food. And a survey found that practically every food vendor did not have good enough knowledge, and that's also an important part of such education in adulthood. Lifelong learning and outreach campaigns, therefore, are needed. As I said, the report takes lifelong perspective. It's not just what is delivered in school. In countries such as Denmark, Japan, Malaysia, and the UK, engaging the community through awareness campaigns was the most important way forward to reduce food waste, which is another potential outcome of an education that focuses and takes nutrition seriously. And workplaces, not just schools, can also be very important. In the Republic of Korea, nutrition counseling for workers improved the dietary habits and ultimately their health. Now, I mentioned already about food environments, and these efforts need to target schools and students, but they also can be broader, need to be broader, and how that is done is extremely important. Because often we don't go into the psychology, because learning is not just knowledge, is attitudes and is behaviors, and the links between these 3 are really missing often, not just in nutrition. That's the whole point of the series on education and the other SDGs, on a range of behaviors that are desirable and yet not observed as frequently as we would like. Chile has created a nutrition profile, forcing some food items to display a black warning label. Now, that has worked in some cases, in other cases it doesn't. A number of countries are now increasingly getting a position on promoting vegetarian diets as a way of limiting their footprint. That could be an indirect way of also perhaps improving health outcomes. The role of cities, because it's also not just the central government that can play a role. A lot of consumption, higher consumption levels, and perhaps the most unsustainable consumption levels and patterns are observed in large urban areas. So the role of cities in shifting those consumption patterns is very, very important. One example of the report here, really the examples are randomly scattered throughout this presentation, but there's a much fuller set of examples in the paper itself. In Lisbon, an alliance of farmers, local governments, families, schools and parent associations work closely, promoting that idea of gardening even beyond the school, taking children to allotment gardens to get exposed to good practices. I mentioned before that one of our core objectives is to remind everyone that education is not just working through its indirect effect. It has a very direct impact on preparing the professionals who will deliver the outcomes that we want. And here we have singled out 3 types of professionals: health and nutrition. Ones are the obvious. Unfortunately, only 14% of countries adequately covered infant feeding and good practices in that in the curriculum of medical professionals. We know that investment in nutritionists for good school meal planning is essential, and yet there's huge inequality between countries in the extent to which they focus on that. We also thought of agricultural professionals, farmers. It is well known that good extension programs can help farmers access information and appreciate the benefits of organic farming. That is unlikely to happen on its own. A push from public initiatives is required. And then food system professionals are essential, those that really have been able to shape the agendas and tackle the problems with the food industry, which is often quite overpowering, requires leaders, as we have seen in countries like Bangladesh, Ethiopia, India, and Kenya, to really have a cross-sector interdisciplinary perspective. And it is also important, especially as farming is industrialized and all the chains, commercial chains as well, it is important to remind those professionals and planners of the need to also remember indigenous peoples' practices that are coming back to people's awareness. Now, just coming closer to the end, we also look at opportunities to monitor the two sectors jointly. The monitoring of education and nutrition needs to extend beyond the first 1,000 days. That's, I think, Don's flag issue. It is important because the vast majority, 80–90% of studies focus on the first 1,000 days, and yet middle childhood and adolescence are also critical and yet understudied. There has been, that's very good news, and we'll discuss later, a new indicator on school meal coverage that has come under the SDG 4 thematic framework under the target 4A on the learning environments. But there is scope to improve that better with linking, for example, the indicator with the national policy objectives, so it's not in a vacuum. The graph on the right shows the coverage rates with the in a range of countries with a dark yellow color. But if we exclude private schools, which are usually not meant to be covered in policy, then coverage can be even universal in some of these countries, even though it appears not to be with the official data. There is a demand to capture more quality dimension. Not all school meals are the same. So to the extent that it's possible to differentiate, this is an area where more work could be done. And also finding ways that such data can be collected more efficiently in the future. More monitoring opportunities exist on issues of coverage of nutrition education in the curricula and nutrition attitudes and behaviors. So coming to the recommendations, Don may like to reflect on the first two.
Hey, thank you, Manos. Can I? So we've really just given you a taste there for the book. The book is actually really very rich and in content, and I'd strongly urge you to have a good look through it. Also, please don't forget that we are going to answer questions at the end of all of this session, or the authors will be doing so. So please put any questions on the Q&A as we move forward. As Manos said, we're now moving on to the recommendations. So I'm just going to talk about the first couple. First is that we need to transform nutrition education into a lifelong learning pursuit. That we need to balance the theoretical and experiential learning. We need to integrate learning about food into media campaigns and not rely, as we seem to now, on random social media messaging. And we need to avoid messages that moralize or stigmatize, but actually focusing on education about food is a really important part about thinking about the health of our nations in the future. And secondly, we want to place schools at the center of efforts to influence sustainable nutrition outcomes. Universal, nutritious, locally sourced school meals programs which integrate nutrition education with adequate nutrition expertise and which improve the food environments. We're really talking about changing people's relationship with food. I'll hand over to you, Manos, for the other recommendations.
And very briefly, I think it was clear throughout the presentation that we need to adopt approaches that are multi-sectoral. Those are the ones that seem to be most effective. We need to not forget to build professional capacity and deploy it equitably at different levels. And finally, we need to also monitor the relationship between education and nutrition through the life cycle. There has been a lot of emphasis in the early years, but that also needs to change. In terms of our communication, just to close this presentation, and thank you for your attention, in parallel to the actual paper, we also came up with this alternative way of presenting, in a perhaps more humorous way, some of the key messages. It has been supported also by one of the UNESCO's Goodwill Ambassadors, David Hum, who has championed issues of nutrition and education and biodiversity. So you see 6 recipes which essentially convey some of the key messages of this presentation in a perhaps more memorable way. Don't forget to share your views. We really rely on you as a group that has gathered here today to pass on the messages of this report. And I would like to now pass on the microphone to Priya, who will take us to the next stage of this webinar. Thank you very much for your attention.
Thank you. Thank you all very much. Can I say that I look back with great fondness to COP28, the first COP in which food actually figured, and that it was food, realization that food was a third of the greenhouse gases. But prior to COP28, it was all about fossil fuels. And I'm delighted to say that Priya Joshi was part of the team there pushing forward that agenda. So it's great, Priya, for you to now talk about this creation of yours that we're talking about today.
Thank you so much, Manos, and thank you so much, Don, for this partnership and this journey with the Research Consortium discussing education and interlinkages. Hello, everyone. I'm delighted to be moderating our panel today. I invite all the panelists to turn on their cameras. We are joined by 5 representatives from organizations working across nutrition, health, and environmental sustainability issues. First, a very warm thank you to each of you for being here and for endorsing the Learn to Eat Well paper, its recommendations, and really for recognizing the critical role education can play in achieving better nutrition outcomes. Your support has been instrumental in helping us reach audiences beyond the education sector. This is exactly the kind of cross-cutting dialogue this education and SDG paper series aims to inspire. So I will begin with a round of 5 questions to the panel. I will introduce them before I pose the question. You have about 5 minutes for this initial response. So our first panelist here is Amy Reed, Knowledge Synthesis Manager, Partnership for Maternal, Newborn, and Child Health, PMNCH, hosted by WHO. Amy, PMNCH works with pregnant women and adolescents in both schools and communities. Could you share how you strengthen nutrition through learning, especially for these groups whose needs are rarely addressed holistically? Over to you.
Hi, Priya. Thanks so much. Very delighted to be here. Thanks for inviting PMNCH to this event, and we're incredibly delighted to be endorsers on this paper as well. And thanks for the question. So just in case, as a bit of background, so PMNCH is the largest alliance for women, children's and adolescents' health and well-being. And we play a critical role in advocating for and supporting improved nutrition from pregnancy through adolescence, through the entire life cycle. And our work often involves more influencing policies and programs at various levels rather than directly implementing school or community programs. And given the short 5 minutes, I thought I would just highlight 3 sort of areas that we work in with a couple of examples, just to show how we are working. So perhaps the biggest one is our advocacy and policy influence area. So we advocate for the centralizing of nutrition as a key determinant of health outcomes for women, children, and adolescents across the entire life course. We emphasize continually that good nutrition is fundamental not only for growth, but as the paper says, educational attainment and overall well-being. We also, in parallel, we highlight unacceptable equity gaps in nutrition. And that might be, again, as the paper highlights, challenges to education and nutrition. And we work to ensure that policies and programs reach the most vulnerable populations, which we are increasingly seeing in this climate is those in humanitarian and fragile conflicts as well. So we do this through a number of ways, perhaps most recently, at least this year, We definitely release a lot of op-eds and media pieces and events that highlight where these gaps are, and offer solutions. I think this is a big part of what we do as well, is offer, which I'll talk a little bit more about as well, is we offer evidence-based solutions for the way forward to make sure that we can close these gaps where possible. We also work at influencing national and global strategies. So PMNCH works with governments and partners to integrate nutrition into national health plans and development strategies. And we push increasingly for political will and commitment and consistent investment in nutrition programs, which is particularly important given the current climate. So our collaborative advocacy action plans, which is our CAPS initiative, this brings together diverse country level partners to accelerate progress on women's, children's and adolescents' health broadly. So these plans aim to strengthen accountability for existing commitments, including to those dedicated towards nutrition and education, and mobilize new ones where there is will and availability. To target specifically vulnerable populations that are identified within these groups too and in country. Perhaps most fundamentally as well is we stress the importance of cross-sectoral approaches. As Don mentioned as well, we recognize that nutrition outcomes are influenced by more than just the health sector. We advocate really strongly for collaboration between health, education, social protection, and other areas to make sure that a supportive environment for nutrition and education is created. Just last month, I think it was the beginning of June, we hosted, I think the 5th of our webinars, our high-level dialogues, which focused on nutrition and commitments for maternal and newborn health. And this was really an opportunity for us to bring in a bunch of different stakeholders across the different sectors to have a conversation on what's really needed and the way forward. So a second major area that we work on is knowledge synthesis and dissemination, and it's a big part of my work as well. And I suppose broadly, PMNCH produces and disseminates, publications, reports, key messages, guidance documents that synthesize the latest evidence on maternal, newborn, child health and adolescent health, including nutrition. So these resources then help inform policymakers, researchers, and practitioners on effective interventions, and generally share best practices and lessons learned from things that did go well, things that worked, things that didn't work in different resource settings as well. So we, over the last 2 years, have released a suite of advocacy briefs, each dealing with a different topic area. And we will continue to do that through this year and through next year as well, focusing on not only the problem, but also identifying solutions based on these multi-sectoral parties that are involved in these topics as well. Perhaps finally, the biggest or one of the most important areas for PMNCH is partner engagement and capacity building. So we are a vast alliance. We have about 1,500 partners, I think last we counted, across 6 constituencies, including government, civil societies, academic and research, the UN, and I know I've forgotten one, private sector as well. And we work to strengthen this collective voice so that we can advocate for nutrition as a core component of health and well-being across this entire life course. An important part of this as well is making sure that we empower adolescents and youth. So we make sure that we have meaningful adolescent and youth engagement. And just to finalize that, I wanted to flag one thing. So in 2023, I believe it was, we launched our What Young People Want initiative, which was a global survey that asked young people what their priority was. The #1 response was that young people wanted opportunities and educations to upskill. I think the third response, over 300,000 young people flagged that better nutrition and health was the most important priority for them. So I think making sure that we involve young people in these discussions is going to continue to be part of our work. And again, I'm very delighted to be here, so thank you so much.
Thank you so much for this comprehensive, discussion. I really appreciate what you said about your role in influencing policies, and I hope that in your follow-up you'd be able to answer a little bit how you've been able to shift policymaker behaviors, right, and attitudes around nutrition, because it's also one of these things of importance. And thank you for highlighting meaningful youth engagement, which I'm sure we'll hear more about later. Thanks so much. Next, we have Marek Kamaladze, who's the head of School Meals Coalition Data and Monitoring Initiative. So, you know, from broad-based policy influence to talking about data, because of course data matters for all policy influence. Manik, one of the paper's recommendations, as you know, is on strengthening data and monitoring systems. What are the key ways you think we can improve school meals monitoring for improved outcomes across all sectors? Over to you.
Thank you very much, Priya. Once again, just to say we're very happy to be here and to endorse the paper. Congratulations on that. As far as data is concerned, I think I will focus in on the SDG 4 indicator on coverage that was mentioned by Manos in the presentation. I think it's important to acknowledge how important it is that an indicator on school meals coverage is now part of this conversation, is now part of the SDG 4 framework. Of course, in the paper itself, you do mention some ways, potential ways for improving it, and I will address some of those issues. In the long term, I think that it's important to acknowledge that the fact that we're putting this much emphasis and visibility on school meals already is a very good step forward. And in the long term, we would hope that more countries would strengthen their internal systems of monitoring and start reporting on school meals key indicators within their own statistical systems and frameworks. And we already see some examples of that actually, and we want to celebrate them. There is Rwanda, for example, that does this quite well. However, in the medium term, we agree with the recommendation that the collection effort needs to be done better, and the way that we think of coverage and the way that this process is administered can improve significantly. In terms of administration, we think that it makes sense, as you put in the paper, for a UN agency to lead on that. And we are currently, in the context of the DMI, considering how to best ensure that that is done. In terms of the quality of the indicator itself and what it measures, as a first step, it does provide a sense of what the different countries look like in terms of coverage overall. However, there is a lot more opportunities to look at it in more depth. In your paper, you do a small subset analysis of some subset of countries by looking at coverage for private and public schools. Our State of School Feeding paper that is coming out later in September this year, we've done something very similar with a different subset of countries that have near universal coverage. And we've done a very similar analysis to show the difference of what the indicator looks like if you only zoom in onto the public sector. However, this idea of looking at the indicator in terms of the specific target for the policy is an important way to understand what's going on in the country, but it's probably not sufficient. Meaning, for some countries, the policy objective is to cover only rural schools. There's quite a few countries that have that kind of policy objectives. For some other countries, the policy objective and the target is a certain subset of vulnerable population that, for example, experiences malnutrition. So there's different ways in which these policies are designed. And it's interesting and very good to understand that level of granularity when it comes to coverage. However, overall, the objective still probably remains to be universal coverage and achieving universal coverage. So we want to know what is happening with all of those children, whether they're in the public schools, whether they're in private schools, rural, urban, primary level, secondary level, and so on and so forth. So our objective should be to get as much of that granular data to be able to really show, broadly speaking, where we stand in terms of coverage towards that universal goal, and then understanding how countries are performing towards their specific targets. I think that's kind of what I wanted to say about that indicator for now. Thank you very much.
Thank you. That was excellent. I feel like you really hit upon the questions of targeting, universality, and it really reminded me of our inclusion, right? Like, how does one include? You have to take a mainstreaming approach, and you also have to do a targeted approach simultaneously. So thank you for your inputs and insights there. Moving on to our third speaker, Miriam Schindler, Program Lead, Children and Young People, Global Alliance to Promote Nutrition, GAIN. Miriam, the question for you is that, of course, you see the paper highlights that adolescents are often falling through the cracks of food and nutrition policy. Why would you say is it critical to center adolescents in food systems transformation? And what strategies that combine learning and nutrition do you think are proving most effective? Miriam.
Thanks. Yeah, thanks so much, Priya. And thank you to both the speakers before me, and congratulations on a great report. So as Priya introduced, I'm Miriam Schindler from the Global Alliance for Improved Nutrition. And at GAIN, what we work on is healthier diets. We are really focused on how do we improve diets for all people, especially the most vulnerable, through sustainable food systems. I'll be honest, I'm not particularly surprised that adolescents fall through the gap. If we look back as early as 2018, the Global Nutrition Report highlighted adolescent nutrition as one of 3 critical areas that we have to work on. And then we had the Lancet series in 2021. That was really one of the first major Lancet series looking at adolescent nutrition. And just this year, N4G, we had 60 commitments that looked at adolescent nutrition. Unfortunately, the number of commitments to school food has halved. The number of commitments around obesity is down, but the commitments around anemia prevention has gone up. I often wonder, why do we not focus on adolescents? Adolescents maybe are not seen as vulnerable as small children. They're more difficult to reach. It's a difficult age programmatically, and they always tend to fall, in between these 2 life stages. And even if we look at the connection with school meals, school food coverage covers primary schools much more than secondary schools. So it kind of somehow makes sense that adolescents fall through the gap, but they shouldn't. Whenever people talk about adolescents, they talk about adolescents in their future role. They talk about them as future parents, future consumers, future workers, future leaders. And I think that, they're a big enough group and important enough to be considered in their own right for who they are now and not just in their future role. And even just reflecting back to Don and Manus's first presentation of just that, if you have better nutrition, you're going to have better academic performance. So why adolescents? First of all, it's a life stage of absolute growth, physical growth. Compare an 11-year-old and an 18-year-old, and you kind of see them completely different heights. They look completely different. But it's also an age where people start to make choices for themselves. Adolescents are making their own food choices. It's not about the parents as much anymore. The decision-making moves away from the home, and it moves to the adolescents, their friends, their social networks. But adolescents also sometimes becoming parents in themselves. They're consumers. They influence and are influenced by the food environment around them. And so really, for me, I think it's a massive oversight not to center food systems on them. So what type of strategies work? I want to mention here a new framework that's coming out from a network that I'm part of, and I know some others on the call are as well, the Global Adolescent Nutrition Network. We've worked on a framework for adolescent nutrition. The paper isn't out yet, but I can share with you the paper that just got published on the process of putting this framework together, which was actually developed with young people. And we look at 4 levels. We look at the adolescents themselves, thinking about household, peers, and schools, on national systems, and on global systems. So I think for me, what fundamentally comes out here is that, we need to think about what improves the environment, the food environment. That's the national and the global systems that exist. But we need to think about what improves about individual adolescent nutrition. We need to be working directly with adolescents, and we really need to think about adolescents as a time that It's about friendships, it's about peer networks, and we need to tap into those peer networks as well. Just before kind of finishing up, kind of 4 really practical areas. So, you know, Marek just talked before about data. Adolescent nutrition data is one of the biggest gaps, and we know this, and there are some efforts going on to address this. What we don't know, we can't address. So really, like, what's an absolutely fundamental strategy is having very, very clear agreed upon indicators on adolescent nutrition that are being tracked on a national level. We need to think about other strategies at work is when they're linked to other areas. Health strategies linked with school education as well. For example, deworming programs, WEFAs work very well. Food environments. So especially when we're talking about obesity prevention, limiting exposure to food marketing, things like soda taxes, you know, adolescents are exposed to so many different messages, like let's make it easier for them to actually make those better food choices. And just one final one, and actually going back to the report, I was really delighted to see in the report that we weren't just talking about formal school education. It really focused on these three areas of formal, informal, and non-formal education. Nutrition and food education has such a role to play kind of beyond the school curriculum as well. At GAIN, we've played around with the idea of play-based education, using gamification as ways to help adolescents learn more about nutrition. And I think like we really need to think about these 3 different pillars when we're thinking about nutrition education, and not just thinking about nutrition as part of the formal school curriculum. So with that, I'm going to stop and back over to you, Priya. Thanks very much.
Thank you, Miriam. Such alignment with how we discuss things in the report. I love what you just said. Adolescents need to be considered for who they are and not just their future roles. I think it's something we all should live with. Speaking of adolescents and youth leadership, our next speaker is Williams. He's a World Vision Young Leader from Sierra Leone. Williams, you are a young global leader, and you also work in schools and communities through the Sumbuya Kids Club. What was your experience of learning about nutrition? And how do you think this experience could be improved for all learners? Over to you.
Okay, thank you very much. I'm very happy for me to be here today. I'm Williams. I'm from World Vision Sierra Leone. And having my first, I'm very sorry because I'm unable for me to use my camera. So I want to ask for consent because my camera is very bad. So I thought it fit for me to use the audio. All right. Having the first-hand knowledge on nutrition, I came to understand that nutrition itself is the foundation of health. It's not just about us fueling our bodies, but about us nourishing our minds and souls. But even at school levels, we tend to understand that nutrition supports our mental clarity and even influence our mood. And sometimes we should be able to prioritize foods that are processed and be able to cultivate healthy relationship with food and our bodies. And throughout my academic journey, I've had the opportunity for me to explore various aspects of nutrition. That is from the fundamentals of macronutrients to the impact of diets on chronic diseases. One of the main engagements that I had with my colleague peers in around the community was the engagement with children on nutrition, the consultation of nutrition. So like we had this engagement, it was us empowering ourselves on what is nutrition and what are some of the better food selections, food choices, like from the previous speaker. And as adolescents, as we grow, our food choices begin to change from different angles to the other. It's something like a life cycle. So like it's something that is very real. So this experience sometimes not only deepened my understanding of nutrition, but it has also highlighted the importance of accessible and real information, because having the opportunity for me to be able to sit with my colleague peers in our communities for us to talk about what is nutrition, because nutrition in Sierra Leone itself, it's a topic that is not always talked about. It's very rare for you to come across people engaging on what really nutrition is. So talking in terms of the educational aspects of nutrition in my country, it's something, it is very, very low, because most of the people do not know what are the different balanced diets that are around and also that are there. and also the different food varieties and choices. Like for me, from a very personal experience, when I was a bit earlier, when I was in primary school, um, I never knew what food varieties are. I only eat the staple food, that is rice. I eat rice the morning and also during the night. Sometimes you can even eat till midnight. And this is something that nutrition education always talks about, that we need to have time when we should eat. It's not only about us knowing the type of food that we should eat, but we should also know the type of the time that we should be able to eat with a particular food variety. So in Tigale, it's something that is not common for us to be able to. It's something that is not common, like us having the first hand knowledge on what type of food variety we should eat at this time or at that time. So it's something that is not like within the community. I've been fortunate for me to participate in initiatives that promote healthy eating and sustainable food systems. And I also had the opportunity for me to have a first-hand experience at the N4G Summit, that is the Nutrition for Growth, that was held by the French government in Paris, where I had the chance for me to engage with experts and like-minded individuals. I have, let me say, sharing insights on innovative approaches to nutrition and health. I also appreciated the opportunities for networking and collaboration. But that was not the thing also. Me coming to have a cultural exchange with my colleague peers from different countries and also from different cultural backgrounds, it's it was really, really important because I tend to understand that nutrition happens in different ways and also in different dimensions across different local societies as compared to where I came from. So it was a rich engagement for me to be able to have the opportunity for me to engage with other like-minded youths around the world on what really nutrition is and how best we can be able to come together in making sure that we really emphasize and really prioritize the habit of eating well and also and teaching our parents on what nutrition is actually. So for me in terms of recommendations, I would say because sometimes nutrition itself it's primarily about food, but sometimes it is not only about food because we need to understand that tackling nutrition there are other sectors that we need to focus on. One which has to do with our education too, and the education aspect, it has to do with us having the understanding of what nutrition is. Most of the times, like for the community where I'm coming from, it's very difficult for parents. If you ask the parents or even a student what nutrition is, they are unable for them to tell you what is nutrition. They are unable for them to tell you what are some of these food varieties. So it's like us make recommendations through the educational aspect of tackling malnutrition for school curriculums to be prioritized in nutrition education programs. And two, one has to do with wash. Wash is very important, water and sanitation, because whatever we do with food, we need to make sure that we practice a very good hygiene, making sure that we have a society where good hygiene is being practiced and also healthy feeding habits are being practiced and also are being observed as well. So I think this is some of the other recommendations that I made. And one of the last one where would be like tackling nutrition. It is not one organization cannot do it. One government cannot do it. It has to. It's a multi-faceted, collaborative efforts which means that it is the efforts of each and everyone within the society, whether it be in the government, NGOs, local civil societies, even the people in the communities. I think even from the health sector, like it's a collaborative approach where we can be able to make sure that people understand what is nutrition and then ways are being put together and making sure that they tackle malnutrition and children have the best for them to eat. Like for me in my community, most of the time we children do not have the opportunity for them to eat 3 times a day. Like you eat sometime mostly one time to one when you eat once when you eat for a day once, that's the end of it, except you have to wait again for another day. So it's like a key message is I'm trying to pass around the world that there are still children within communities that are going astray. There are still children that die out of as a result of malnutrition every day in our community. Sometimes, like for me, I've had the experience. I only eat once in a day, and when I eat once, sometimes that's the end of it. Like it's quite different as to what I saw during my visits to Paris when I was opportunity for me to be part of the Nutrition for Growth Summit. So you tend to understand there are some different kids around the world. Sometimes they eat 2 times, sometimes they eat 3 times. Some children sometimes go for the rest of the day without having nothing to eat. So it's quite a sad thing. But I think it's about us passing the messages and also prioritizing the educational aspects of nutrition. So I may like to stop here and
Thank you so much, Williams, for highlighting, youth leadership, for experiential learning, and also multisectorality, including wash, sanitation, and for your last comment on, nutrition. I move on finally to Florence Lasben, Managing Director for SD Foundation, focused on skills, systems, and synergies for sustainable development. Florence, the FOSD Foundation co-convened over 400 nutrition dialogues ahead of the Nutrition for Growth Summit. May I ask you to broadly reflect on the themes of education that emerged from these conversations? And also, how do you plan to build on that momentum?
Thank you very much, Priya, and thanks and greetings to all participants. I'm really pleased to be here to highlight how education indeed was seen as a vital component of nutrition by the 10,000 participants who joined the 350 dialogues that were held at the end of 2024 to feed into Nutrition for Growth. Of these participants, almost half of them were young people or adolescents under 18. Some of them have convened those dialogues. What did they highlight? Most of them have talked about school meals. Kudos to the School Meal Coalitions and all of those who are working in this direction. It's there. Nevertheless, children, as we can expect, see that the coverage and the quality of school meals could be improved in many places. But they also highlight that school meals are not enough. They want to understand what is nutrition, as William just said. They want to understand where is the food coming from. And they want the nutrition education as a form of lifelong learning, as the GEM report is encouraging us to consider. Let's go into more details. Children and adolescents described how hunger disrupts their ability to concentrate in school, but also how they lack knowledge about food. They don't know how it's prepared. They don't know the meaning of certain dimensions of food. They don't always know the impact, though they have a very strong sensitivity. It was a big learning for me, hearing how many adolescents are worried about the quality of the food they are offered in school meals and beyond. They have a sense, they don't use the terms we use at global level of ultra-processed food or very specific definitions, but they have a sense that what they eat will impact their health and their future, and they want to understand it better. They ask to learn how to cook, how to read labels, how to grow food, how to protect their health, and how to advocate for change. They want nutrition education to be practical, joyful, and empowering. But we heard also from the caregivers, the mothers, they asked for hands-on training and support. They also want to understand how to feed their families, but with the food they have. They don't want to hear again about what is written in nutrition textbooks. They want very practical advice that connects to the food that is available to them. Sometimes they hear about certain advice, but they don't know how to process, not ultra-processed, the food they have at hand. They want to talk about it. They want to share with each other, and they want some experts to tell them a bit more so that they can learn in the process. They want, as I was saying, peer-to-peer advice rooted in local culture and experience. And we heard also that the role of fathers matter, of course. Whilst they are rarely the ones cooking at home, they often control much of the household budget, and kids understand very quickly that the quality of the food they can get depends on the decision of dad and the cooking of mom. Dad needs to be involved in any conversation on nutrition. Let's not forget about that. The young people, the adolescents, Miriam said more than I will say, but they ask for skills indeed. They want to be trained in food production, in food safety, in entrepreneurship. So they want knowledge about food now, but they also see a link between nutrition and economic opportunity and leadership. They see nutrition education as a pathway to dignity and livelihood. The nutrition dialogues taught us that nutrition education must be lifelong, as the GEM report said, starting early, reinforced in schools, and continued in homes, health centers, workplaces, and public campaigns. And it must be participatory. Children are empowered to teach their peers. We heard from Williams. Mothers appreciate learning from each other, and local leaders too. They hosted community sessions in local languages, and they felt that it's when in those discussions that the nutrition knowledge became lived practice. So this is our call on the coalition, Priya. Your leadership has already made school meals a global priority, and really kudos to all your efforts. Can we go one step further? Can we help talking about nutrition when we are delivering school meals? That's only an entry point, but it's an entry point that can go a long way. With the nutrition dialogues, we want to stay present. It's a very small platform. We are seeking partnerships to help embedding talking about nutrition in local systems, strengthening the learning infrastructure around the dialogues, and investing into the leadership of the young people, adolescents, who really want to talk about nutrition for their future, and they have the sense that it can transform the livelihoods in their communities. I will leave it there, Priya. I will put a few things in the chat for those who want to read more about the nutrition dialogues. Thank you very much.
What a rich set of insights. I'm afraid we're running out of time. So I would like for all of you to give me maybe a quick reflection, a final reflection, maybe reflect on what you've heard, but also to maybe just say, what is one change or action you believe could make a real difference? Let me start with Marek.
Thank you very much. I think my one reflection will be that let's not have perfection be the enemy of the good. We already have something solid for at this time in terms of knowledge on what is happening in a large part of this world in terms of coverage. And I think the objective would be to build on this little by little. And I see a lot of potential improvements, but I also think that it's important to acknowledge that we're at a very good starting point. So that's my call to you. Thank you.
Amy, your last call to action, maybe.
Yeah, thanks so much. So I think William said it when I said, one organization can't do it all, one government can't do it all. And I think even in Don's presentation, it was that holistic approaches deliver results. So I think we need to work better, to collaborate together better. Maybe not, that was a perfectly imperfect sentence, but we know what needs to be done. We just need to work better to get there. So I think that would be my takeaway. Thanks.
Thank you so much for that. Miriam?
Yeah, thank you. So I think my takeaway is let's move food education beyond the school curriculum. Amy mentioned this, that, this was one of the top priorities of young people, that they want skills. Florence mentioned this, it's a link between nutrition education and job opportunities. And so for me, let's think about food and nutrition education as a life skill. Let's adapt it to different ages and let's make it fun. Okay, back to you.
And Florence?
Thanks. I'm backing up all the messages from my fellow panelists, but I will add and engage with these adolescents and children. They have a lot to say. They know what they are talking about, and they have very smart ideas.
The last word to you, Williams.
Well, for me, my last message would be like to all global leaders that every day a child dies out of malnutrition, every day a child dies out of hunger. So it is time for governments, NGOs, global leaders, and experts that do prioritize children, the well-being of children, to make sure that there are strategies and also efforts being put in place to engage children and also get them informed, especially the parents, and also with other technical, structural ways where they can be able to make sure that nutrition, children's nutrition is being prioritized at all levels.
Thank you. Thank you so much. This has been such an amazing panel. Thank you so much for sharing your rich insights. We now will pivot to expert reflections from three of the contributing authors. They are all nutrition community of practice co-chairs at the Research Consortium. Their regional and national expertise fed into this report. Let me just introduce them. Dr. Robert Akbabiro is Associate Professor of Global Health and Nutrition at the School of Medicine and Population Health, University of Sheffield in the UK. Ms. Bimbola Adansanmi is the West African Regional Director of the Partnership for Child Development, Imperial College. She is based in Nigeria. And Dr. Gopinath Radhakrishnan is Principal Scientist with MS Swaminathan Research Foundation in Chennai, India, with a core specialization in agriculture and rural transformations. So Robert, Gopi, and Bimbola, thank you all for this partnership between the Research Consortium and the GEM report to get us to this exciting stage. I just wanted to hear from you and discuss with you your reflections on the role and impact of education for nutrition and health after having been part of this report, and to understand from you, the learning journey on understanding why it is important to embed education into health and nutrition agendas. And let me start with Robert.
Thank you very much, Priya. Let me use the opportunity to thank the incredible panelists for their insights. Thank you for supporting the report. As Don said, the book or the report is very rich with useful information that we can all draw on for our advocacy work, lobbying government to do more to support nutrition and health of our young children. We know that in the literature there are a lot of evidence around the link between education and nutrition, especially the impact of nutrition on education. And I think Don and Manu's presentation did clearly highlight that. So there's evidence around increased enrollment in schools. There's evidence around reduction in dropouts rates. And there's also evidence in academic performance for young children when you implement nutrition interventions in schools. So there's no doubt about that. Now, being part of this report has reinforced my appreciation for the pivotal role that education plays in shaping the nutrition and health outcomes that I've just talked about, especially for this age group. We know that the school age and adolescent age is marked by rapid growth, cognitive development, and the formation of lifelong habits. And I think Don did highlight that in his presentation. We know that it presents a unique and powerful window of opportunity to instill knowledge, attitudes, behaviors that promote health and well-being throughout their lives. Now, throughout the process of producing this report, it has become even clearer that integrated nutrition education in the school settings and more broadly in the education systems is not just beneficial, but essential. So most of our advocacy work needs to hammer on this. We know that schools are one of the few platforms that we can reach children consistently and equitably, providing a structured environment where nutrition messages can be reinforced through both the curriculum and practice. And you can mention examples like school feeding programs, healthy food environment, and peer engagement, as some of the panelists have alluded to. And so embedding education into health and nutrition agendas for this age group is important, and I want to highlight a few reasons why we need to do this. One, we know that nutrition education through childhood and adolescence supports the development of healthy eating habits, as I've mentioned earlier. That then tend to reduce the risk of both undernutrition and overnutrition. And I think William was talking so much about every minute one child dies. And then we also know they are linked with associated non-communicable diseases in later life. So this is quite important that we highlight them. The second point is that education equips young people with the critical thinking skills that is needed to navigate food choices. It is in an increasing complex environment that they find themselves to make those kind of choices. That then gives them the agency over their health. So it's important. The third point that I want to mention is that adolescents in particular, the girls, are our future parents. And so improving their nutrition literacy can influence the health and nutrition on the wider or the next generation. So it's not just targeting this group, but we are targeting the wider generation. The third point I want to highlight is that we need to embed nutrition into education because it helps reach marginalized and vulnerable groups who might otherwise be missed out by the health systems. Most of our health systems, especially in developing countries, are weak, that they are unable to even support some of these. And finally, I want to emphasize that this report has highlighted the need for a more integrated, sustained approach. And I think Manu just mentioned that in his presentation, where education is recognized not just as a delivery mechanism, but as a strategic intervention in its own right. So if we are to truly advance the health and nutrition of school-age children and adolescents, we must then place education at the heart of our agendas. So I'll stop here for the interest of time. Thank you.
Thank you so much, Robert. Bimbola, you have so much expertise on Nigeria and also West Africa. Perhaps just a reflection on what was new for you, through this journey as well.
Thank you, Priya. I want to appreciate the panelists also because they have even discussed further on the paper itself and have enriched us and our thinking. For me, the reflections on the role and impact of education has brought more lessons around education throughout the life cycle. What we have been using in the nutrition space has been nutrition throughout the life cycle. But looking at this paper, we look at how do we transform education, especially education that deals with nutrition and health, into lifelong learning pursuit, as we had recommended in the paper. And I'll just use the example of Nigeria, where for us here, the human capital development is a central pillar to national development strategy. And one of the things they're looking at is how do we, through education, bring down the social determinants of health and nutrition. And one of such is poverty. And through education, they're looking at how can we reduce poverty, reduce food insecurity through lifelong learning in schools. And so it brings me to the other recommendation we made, that we should place schools at the center of our efforts to influence sustainable nutrition outcomes. Basically, it talks about what are we doing to improve the health and nutrition of adolescents and young children. Yes, we may say we're providing meals for them, but as Florence said, we also need to look at what they need to know about nutrition itself. What is it that we need to focus on as professionals? And one of the things that is being focused on here is through the school feeding program, apart from providing healthy meals and healthy options for diets, we're also looking at garden-enhanced learning. Nutrition education that is fit for purpose, that is interesting, that is exciting, that allows these children to take up something that improves their health and nutrition. But apart from that, we're also looking at embedding nutrition education into teacher training, using the existing professionals in the school and building their capacities to be able to deliver on nutrition education. It's one of the key things that is being introduced into the policy trust of the country. And thirdly is also integrating nutrition education into the school curriculum. Of course, it's been there, but as the learnings that we have seen from the voices of adolescents throughout the food systems, dialogues that had been held in the country, it now has to be inclusive, it has to be interesting, it has to be fun, game-based. And that is something that the country has taken up to learn on. And looking at how these two merge with the human capital development drive, we want to see how to promote sustainable agriculture and food security using nutrition education, particularly within the schools for these children. I think basically throughout the report, it's been interesting looking at how this journey of children, before we had looked at the first 1,000 days, but now we're going beyond the first 1,000 days to look at the 7,000 days and focusing on nutrition education for them through the school system. So school feeding, yes, is a platform to enrich them in terms of nutrition, but also enrich them in terms of educating their young minds about how best to eat, how to eat well, and learning to eat well. So I think that's, for me, a learning on itself. Thank you very much, Priya.
Thank you. Gopi, again, such a lot of expertise on India. What would you like to share, please?
Thank you, Priya. Thanks to you, the team, and the panelists for giving this great opportunity. And it's like a thought-provoking. And unlike Bimbola and Robert, I would like to say what we feel that this report, while involving in preparation of this report and also this listening these panelists' voices, I mean, it raises a kind of concern about about the school meal program and integrating nutrition with education in India, because India, a country which is running our largest school meal program in the world, and also having diversity within the country, which we always highlight. So this gives a different experiences. So there's few experiences that we have quoted in our report is also from not across the country, but from few parts of the country. One thing that we observed is here in India, the coverage, even this school meal program coverage is not for entire adolescent age group, but it's from 6 to 14 age groups only. That is one concern. The second one is, I mean, our presentation also highlighted that students involved in private schools having opportunity to not covered under this program, and economic empowerment leads to increasing this proportion. That one kind of thing is there. But these two things are important when we see that the integration of nutrition and education after 6 years. So below 6 years, it's a supplementary nutrition with some nutritional education to these kids and their parents. But once they enter into the primary school, and the integration is somewhat missing, where the report rightly highlighted that this nutrition education should be a lifelong learning. So that's where this report is getting important, and I like this the Robert's point that highlights we need an integrated systems approach rather simply delivering these programs, which is very much important for a country like India. And the staff means not only the school teachers, but the staff who have commitment to deliver the school meal program should also get involved in this nutrition literacy. And as far as this India is concerned, the third important thing is informal and non-formal educations, because the kids who are coming to schools and who are in the adolescent age groups, they see this school meal program only, but this informal or non-formal education, even learning from their own local, which is missing. There are some pilots by non-governmental organizations linking farmers with school children, but it doesn't bring into higher level and influencing the policymakers to involve local farmers and local producers as a source of learning for these school kids, because this is getting very important as we always emphasize on a whole school approach rather simply addressing this better delivery of this system. So these 3 points are very much important as far as this India thing is concerned. And as I already mentioned that we need to propagate these findings and the recommendations at a very large level in a way to influence these policymakers, particularly a country like India. I stop here. Thank you.
Thank you so much. For me, the journey was really about being part of the nutrition community, understanding your perspectives, and also understanding the tremendous effort done by the School Meals Coalition across all sectors. What we need is a truly multi-sectoral approach to the Sustainable Development Agenda. I think we've really had an amazing journey with this. Thank you so much. I now hand over to Dawn to moderate our conversation with the audience.
Okay, thank you very much, Priya. It's been what a wonderful session this has been. Really good to get these very different but very aligned insights, as you said earlier. We've got 2 questions come in from on the Q&A that I would like to share. So actually, I'm going to pose this one to Manos, if Manos is still there, feeling able to answer it, because it's a question about UNESCO. It's a question coming in from a researcher in Germany who's been working in Kilifi County in Kenya. And she says, I'm curious to know how UNESCO promote young research scientists working in the area of school meals programs. And is there a collaborative group for sharing their results? So
thank you, Don. Thank you, Eve, for the question. I mean, a small clarification that we are hosted by UNESCO. We're not implementing UNESCO programs, so that's a small clarification. But the colleagues who are working on school health and nutrition issues, and including on school meals, are just down the corridor. So I'm happy if you share your contact details to bring in touch with them and explore opportunities that they might have in their upcoming work. They don't generally carry out research, but they implement programs often in collaboration with partners. So I would be very happy to do that.
Super, thank you, Manos. And as you said, it's Eve Chakacha who asked that question. So thank you, Eve, for that. And the second question is from Akemi Yokoyama, who refers to the Japanese system. We talked about it a little earlier with the Tsukuyuku approach, but here this is a question around disability. And the question is, guided by the principle of leaving no one behind, we are deeply interested in the current situation of school meals for children with disabilities. And I'm seeing an answer. I'm seeing that that Robert Akparibo, Professor Akparibo, has suggested that he would like to answer this question, to address this question. So over to you, Robert.
Sorry, I didn't get the question, so I was distracted. What was the question again? Sorry about that.
Sorry, Robert. So it's the only reason I'm picking you out is because there's a note here that says that you would like to answer it. So it's the question is, guided by the principle of leaving no one behind, we're deeply interested in the current situation of school meals for children with disabilities in developing countries. We would appreciate your insights. In this case, it's going to be yours, Robert, on that. What are your thoughts on school meals and addressing the issue of disability?
Thank you very much, Don. I think that school meal, well, all children are entitled for. We need to carry everyone along, as someone said, leaving no one behind. And I think disabled children are equally really very crucial in the delivery of school meals. And I think that currently the system doesn't favor, especially in developing countries, the system doesn't favor disabled children. And some of the advocacy work that we are doing is to ensure that governments school meal programs are inclusive. And when I say inclusive here means that every child must be given the priority for education. And in that case, school meals need to be scaled up to cover all these age groups. So I think we all have a responsibility to drum home this message. Thank you.
Great, thank you for taking that one on. Obviously, this is an issue that's underrepresented in our discussions, and it's very important that we change that. So I've got another question now that actually Priya has put into the chat. And this question is for all three of you national experts, and it's going to be the question we're going to finish on. So the question is about the recommendations and the integrated approach that are described in the report. To what extent are those enacted in your countries in terms of your national programs? So I'm thinking here about Bimbola with Nigeria, Robert with Ghana, and Gopi with India. To what extent are those recommendations and an integrated approach enacted in your national programs? Perhaps I'll start with you, Gopi.
Thank you. Actually, that's a concern. That's a takeaway from our report, that it should have been integrated. And there are some mentions in the policies, but it's not really integrated. So, I mean, the nutrition, importance of nutrition that they mentioned in agriculture-related policies, but when it comes to a school, other things, it's not properly integrated. Actually, we take this one and we try to disseminate this importance to a government through this report. That should be the takeaway from this one, as far as India is concerned. Thank you.
Right, thank you, Gopi. Can I now turn to Bimbola, please?
Thank you. I think also from Nigeria, we have a bit of integration. We would, I think the desire is to have more in the sense that looking at nutrition professionals within the school system, helping them pass across this messaging, collaborating with the education professionals, allowing both to bring this knowledge to the children themselves is one thing that is lacking. And so there's a sort of tussle for whose space is this? And that is where Nigeria is really working hard to ensure that, firstly, nutrition professionals, health professionals, education professionals have the same type of messaging. And then the second is to ensure that this is monitored across the life cycle of the child in the education system. So the integration is to a large extent being worked on. Thank you.
Great, thank you, Bimbola. And let me just say that we've got a message in from Michael and Nayo, thanking you personally for your great work on the school feeding program in Nigeria. So that's a nice message to start to wind up on. Robert, what would you like to
Thank
say?
you. I think I want to emphasize on the nutrition professional bit, because across the whole of the African continent, that is a main problem. I think we have identified that as a key issue that we need to address. And I think last year we did convene a workshop to discuss some of the issues and how we can address them. So I think it's not just a Nigerian issue. It is an issue that is across the continent, and we are working very seriously to address that. Now, we have written a blog about how Ghana is really engaging or integrating education initiatives within the Ghanaian National Nutrition Framework, which I think the Research Consortium shared it among the wider network. So if you've received it, please make time to read it. The key initiatives here is going beyond the delivery of nutrition in schools to engaging with local community members using behavior change communications. And I think that these are strategies that we have found to be very, very effective. And we would, in our advocacy, we are going to be encouraging that in engaging with the stakeholders or key people who deliver some of these interventions or strategies to scale them up to benefit. Scale them up in most of the countries that we are trying to.
Excellent.
Work. Thank you.
Excellent. Thank you very much, Robert. So final message that came in is from Robert Fungo, who's the president of the Federation of African Nutrition Society, and he's offering compliments to everyone involved in producing such an excellent paper. So congratulations to you all. I certainly add my congratulations. Well, there we have it. We've learned to eat well and to eat well to learn. Food education, the relationship with food is crucial to lifelong health. Please read the report. Please provide feedback on the report to Manos. That's crucial for maintaining this the high standards. We've got the UN Food Systems Summit +4 coming up in Addis Ababa in July, and we've got the Global School Meals Coalition Summit in Fortaleza in September. Lots going on, lots of activity. Thanks for this call. Thanks for joining us. You've been a fantastic audience, and we look forward to the next time we get together. Thank you to everyone who's organized this seminar too.